Hi, my name is Mazda Shirazi, a medical toxicologist and the medical director of Arizona Poison and Drug Information Center. In sharing this informative guide for other healthcare providers that was put together by Southwest Environmental Health Science Center at University of Arizona. I want to thank our colleagues, especially Dr. Beamer and her colleagues, for putting this slideshow together and giving me the opportunity to discuss this important topic to my colleagues and other healthcare providers in our state. So as you're aware, there are chemicals that are called Per and Polyfluoroalkyl Alkyl Substances, or PFAS in general. They're also known for forever chemicals or long-lasting chemicals in our communities. They are now concerned about exposure to these chemicals and what they cause. And in general, when a patient presents to you, how to go about taking care and acknowledging their exposures and how to assess them. So again, there is about 15,000 of these chemicals. They are used in a variety of settings. Some of the heavy areas of use are in fast food wrappings and linings of foods that are served. They are also used in some of the non-stick cookware and such. There are some of these chemicals in water and stain-resistant sprays. They have some uses in also cosmetic products, dental flosses. They are used in firefighting foams, and they have also some special uses by the military. So what are the pathways of exposure for these chemicals? Again, majority of the pathways, or the largest pathway of exposure, is through ingestion of foods. Now, again, these are what we call fast food products, and the way they're wrapped and the way they are presented in terms of use. And that's the largest area of exposure, which gives us actually a very large area that we can modulate to decrease individuals' exposure. The second largest is the water and the contamination of water, and there are ways also to impact this and decrease exposures. And then a third way would be through respiration of dust that is either contaminated or the chemical themselves. So what are the health effects of these? And that's important. These exposure to these agents or chemicals has been correlated to atherosclerosis and stroke, cardiovascular disease such as myocardial infarctions, increased cholesterol levels, and a change in pattern of also your cholesterol panel. They've been associated with scrotal and prostate cancers, renal cancers, and some hematologic cancers also. They can cause disruption of endocrine function, specifically thyroid, and they can disrupt and implicate kidney and liver functions. There are adverse effects that are seen in pregnancy, especially with low weight and preterm deliveries, and development of some of the diseases such as hypertension in pregnancy. And they can also, these chemicals can impact or modulate immune function and response to some of the viral infections and diseases. So let's go forward and see if a patient presents to you with the concern of exposure, how do we go about working them up? So you have an option either referring them to the specialty clinic or toxicology clinic, where we do environmental, occupational, and exposure assessments. And usually what's important to us is the place of exposure, how long they were at that place, the frequency of exposure, and then some of the activities that are highly correlated with risk of this exposure. Again, dietary and consumer product use and water in certain areas have been known to have higher levels of contamination or these chemicals, and one needs to ask those questions. Proximity to manufacture and areas that handle these chemicals are important. Again, places such as factories that produce these, military bases, airports, water waste treatment plants, landfills, and such can give you an idea about the potential and frequency and duration of exposure. Occupational exposures are also important, and some of the recreational activities. So areas that they produce these chemicals and factories, if you are a firefighter and work with the suppression of fire using firefighting foams, those who do wax, use ski wax and chemicals such as that can also have higher levels of exposure. Now, if one has exposure, then serum level of these chemicals can be obtained both as some individual chemicals and then as a category. And environmental testing in many areas of the country has been done, including in Pima County, in the state of Arizona, and also city of Tucson, that one can look at and assess potential risk for exposure. There are special populations that can have a higher impact of these, especially during fetal development and organogenesis, and then during childhood, during breastfeeding and such. So they are, like any other exposure, there are special populations that have higher risk of exposure. We sort of alluded at them, one of them being workers in these PFAS manufacturing, chemical manufacturing plants, and the other one being fetuses and during pregnancy, infants, pregnant mothers themselves, and nursing babies, and some of the immune compromised populations can also manifest health implications or have a closer correlation with manifestation of the disease after exposure. It's not all doom, and one has to realize that there can be lots of things done to reduce exposure. And many of them are avoiding the products and environmental contaminations that surrounds oneself. So eating fast food, wrapping that contains PFAS, decreasing foods that are microwave, such as microwave popcorns, not utilizing and not cooking with Teflon or nonstick cookware, not utilizing stain and water resistance sprays and such, and then looking at personal care products such as cosmetics that have fluoride ingredients can be ways to decrease one exposure. And one can refer to the site provided here to look at the other activities that can be done to reduce an individual's exposure. And we should always present those to patients so that patients are empowered to actually take care of themselves and decrease their own exposure. So there are some diseases, as we mentioned, such as cardiovascular, gastrointestinal, hematologic, musculoskeletal, dermal, endocrine, and immune and reproductive system that can be affected, especially if one has a higher risk exposure. And they are areas that we still not clear what exposure would cause. There are specific conditions that one needs to sort of look at closer. Diabetes, cancer, hepatic and renal dysfunction, reproductive diseases, and adverse outcomes in pregnancy and conditions in pregnancy that can be sort of markers for manifestation disease after high-risk exposures. Here we have NASAM clinical guidelines. They sort of looked at levels of PFAS in serum, and they looked at pregnant individuals, whether they have levels 20 nanogram per mils and above, or it is below 20 nanograms per mil. And they have made certain recommendations in terms of thyroid function assessment, in terms of looking at the cholesterol panel, and then screening one for hypertension during pregnancy, breast cancer, and other manifestations that could be used using the level of PFAS to guide your care of the patient. There is also ability to decrease PFAS, especially as we said, the second largest source of exposure was water. First being food, and both of them through ingestion. So food exposures can be decreased by changing one's diet, changing one's types of food that one ingests, or type of activities or cookware. With water, there is actually filtration systems that can be used to decrease one's exposure. And here we do have sites that you can go and look at these simple charcoal filtration that are very effective to decrease one's exposure. In discussing things with patient, it is important to not paint the doom and gloom picture, but also show that over time, exposure and presence of these chemicals has been decreasing in our environment and water. And here's a curve showing that, and looking at serum levels in nanogram per mil and what has happened from 1990s up. In Arizona, we have many resources: Marana Water, Tucson Water, and Arizona Department of Environmental Quality. And they do test and detect PFAS in their in the water. There is maps that are interactive maps that can help you assess individuals and close to what areas they live and what potential exposures they could have. Pima County also has produced an update and a report for their health department and for the county that's available through Southwest Environmental Health and Sciences Center, and looks at these chemicals and has some guidelines of monitoring and decreasing exposures. Here's the city of Tucson, and that talks about drinking water. And actually, what's most important is the maximum contaminant level. That's the highest amount that one or individual can be exposed to. And these levels are also have been described. And as you can see, the drinking water of city of Tucson actually has some of the lower levels as when you compare it to some bottled water. And again, as I said, there's not all gloom and gloom, and our exposure levels and the levels both in environment and in water and individuals' blood samples shows that there is a decreasing amount of PFAS, and that trend maintains itself over time. If you want to know more about this, here's National Academic of Science, Engineering, and Medicine guideline that you can look at to give you a better idea. There is also this case that I'm going to present that we can discuss. And here is a female patient, age 42, that has concern that, hey, I'm an office worker, but I'm concerned because there has been reports that I live close to base, and that my water might be contaminated with PFAS and what can be done and how do I need to be assessed. Again, we do need to sort of acknowledge that there might be a potential exposure. We need to explain that not all exposure means manifestation of a disease, and we need to assess their signs and symptoms. We need to also provide some education in terms of how to avoid these compounds and how to mitigate one's risk. Then one needs to get exposure history and do a risk evaluation, and that can be done with both the exposure history and patient's history of their water use, their occupational exposure, their residential history, and their diet and lifestyle, and their specific family and risk factors that they might have for cardiovascular and other diseases. Serum levels of PFAS can be obtained, and they are, again, some general guidelines of what to do with that level and whether it's above or below 20 nanograms per mil and how to deal with that patient. There are normal health screenings that one does, and along with exposure history and levels can sort of guide us to see whether we need to do any further testing. Again, those health screenings that are done during annual visits, such as thyroid function tests, liver function tests, lipid panel and profiles, can help assess potential exposure and manifestation of disease. Environmental testings that has been done by city, state, and federal government can guide potential exposures, and there are actions that can be taken to decrease exposure and impact potential manifestation of the disease, such as lifestyle modifications and simple charcoal filtration of one's water. And then monitoring of the individuals and monitoring them in specific areas, such as if one becomes pregnant, if one has cardiovascular disease and has had exposures that are significant. And one can be involved with their community to look to see what community is doing to decrease exposures. If you would like to learn more about this, you can also get CME or continuing medical education through various sources, and we have provided the QTR here. And here are other links if you're interested. Here are some of the resources that was used. And if you have any questions, you can either use these resources. You can call us at Arizona Poison and Drug Information Center, and we can help you to best of our capabilities. Thank you, and I wish you a great day.